Hi friends, this is Julia Dietz. I did my article, it was titled, A Randomized Controlled Trial of Routines-Based Early Intervention for Children with or At-Risk Developmental Delay. And the authors were Awen Huang, Mary Wan Chan, and Shu Wen Lu. And you can see that. I chose this article because last year I did a long-term sub in the Birth to 3 program, and we were using the routines-based early intervention for 4 years at that time. And I noticed that the parents were very engaged. When I would come, they were excited to tell me about their week and what they had done, and the accomplishments they made as well as the difficulties. Where 4 years ago, before that, I did another long-term sub in which I did some home visits, and we were using the traditional home visit style. So in this article, they defined routines-based early interventions as the teachers were collaborators with the families, and the role that they played was to empower, coach, and support families in finding and discovering opportunities in their family's daily routine. In the traditional home visit, the article defined that as they used traditional 5 domains, and they would use a specific curriculum called the Carolina curriculum for infants and toddlers with special needs. And they described as the teachers coming in and directly teaching the child as well as instructing the parents on how to use these curriculums to help them feel more comfortable in their home and meet the goals that were picked out by the teacher. What I found interesting was that when I was doing the traditional home visits in Owatonna about 4 years ago previously, we just brought a big toy bag and we developed our own lesson plans based off the 5 domains and what their eval said were the needs. And then we just came in, taught them. Many of the parents would just be leaving me in the living room with the child, doing kitchen work. Many of the kids I serviced in a daycare, and I just would go in and either pull them out to a quiet place or stay in the room. So there's a big difference. So I chose this article, and some of the key points that I found were that the traditional home visits they used to measure their success, they used the 5 domains, and they used standardized tests to reflect expected achievements by age. And the routines-based early intervention, they used the Canadian Occupational Performance Measure to measure parent satisfaction with child's performance. And then this article supported what I thought. The routines-based early intervention was more effective than the traditional home visits in promoting functional outcomes, particularly self-care, and reaching family-selected goals. Both groups, though, in this study showed equal improvements in the developmental domains, with the traditional home visits scoring specifically well in the cognitive. And we could speculate for those reasons, but I don't have time here. And finally, they concluded that this randomized controlled trial demonstrated that routines-based early intervention can have better effects on selected functional outcomes, more so than the traditional home visits. And what's interesting is these effects were evident in the first 3 months of the 6-month intervention stage, and then they were sustained through the 6-month follow-up. So that tells us some other things that we could speculate on, but it supported what I was seeing in my work last year. Thank you for your time.